Hello, good afternoon all. Today we discuss the topic or learn the topic. It is called as the diuretic, especially for the pharmacology B Pharm third year student and the PharmD third year student, which is the common topic. It is the diuretic drug. So what do you mean by first diuretic? Diuretic are drug which cause a net loss of sodium and water in the urine, called as the diuretic drug. Okay, so it is the a drug which cause net loss of sodium and water in the urine, are commonly defined as drug which increase the amount of urine produced by the kidney, okay, called as the diuretic. So again, diuretic classify definition as it is the augment renal excretion of sodium, okay, means it inhibit the reabsorption and hence it causes the renal excretion of the sodium and either chloride or bicarbonate primarily and water excretion secondarily, are called as the diuretic. Okay, so simply these are the drug which causes net loss of sodium and water in the body, in the sodium and water in the urine. It is called as the diuretic drug. It is act by inhibiting the reabsorption. Due to the reabsorption, it is inhibited. It causes the renal excretion of the sodium and water, also the chloride and bicarbonate also. So by this diagram, you can clearly see that simply before study the diuretic, you must understand the structure of that of the nephron. As you know, through that of the 12th year, you know the this structure of the nephron. Okay, this is the glomerular. It is the filtrate. This is the Bowman's capsule. Okay, okay, renal artery. This is the filtrate, and this first part it is called as the proximal convoluted tubule. Okay, so this this is called as the loop of Henle. This is called as the distal convoluted tubule, and last part it is called as the collecting duct. Okay, so the most thick ascending part of it is called as the loop of Henle. So this is the target of drug action. I will explain one by one. Okay, so simply you can understand that sodium and hydrogen exchange it is occurring that of the proximal convoluted tubules. Okay, so this is the sodium chloride and the potassium co-transport system. Co-transport means because it is transported along with sodium chloride and the potassium. Now the sodium chloride it is the side 3, and sodium along with that of the hydrogen along with the sodium and hydrogen it is side 4. We will discuss one by one. Active transport, this is the part it is called as the medulla, and above part it is called as the cortex. So simply you must understand the this is the diagram of that of the nephron. Now you see the classification of diuretic. It is the high efficacy diuretic, inhibitor of sodium potassium chloride co-transport system, sulfamidyl diuretic, furosemide, bimetanide, and the toracemide. Why it is called high ceiling diuretic? Because it inhibit the this transport system present in the ascending loop of Henle, and hence it is called as the high efficacy, which gives the more efficacy diuretic. Okay, now second it is the medium efficacy diuretic because it inhibit that of the sodium chloride symport. It is a medium efficacy diuretic. Example are benzothiazide. It is a thiazide which is just like a sulfonamide like compound. Example hydrochlorothiazide, benzthiazide, hydroflumethiazide, bendromethazide. Okay, so these are the first category. Second category, thiazide-like diuretic, chlorthalidone, metolazone, zipamide, indapamide, and the clopamide. Now, third category, it is the weak or adjuvant diuretic. The first it is the carbonic anhydrase inhibitor. Okay, this is the enzyme which is inhibited by the drug acetozolamide. Potassium sparing diuretic, because one of the side effect of this above drug it is the hypokalemia. Now this for prevention it is the potassium sparing diuretic. Aldosterone antagonist. Aldosterone it is a hormone which maintain the sodium and potassium balance. Okay, aldosterone antagonist, spironolactone and the eplerenone. Inhibitor of renal epithelial sodium channel, trimethoprim and the amiloride. Osmotic diuretic, mannitol, isosorbate and the glycerol. Okay, so this is called as the classification of that of the diuretic, which is generally asked in the examination. So again this is the diagram of that of the nephron. This is the glomerulus. This is the Bowman's capsule. This is called as the PCT, loop of Henle, distal convoluted tubules, and this is called as the collecting duct. This is called as the collecting duct. Now we'll see the first high ceiling diuretic, or it is called as the loop diuretic, which is the inhibitor of sodium potassium chloride co-transport system. Okay. Now furosemide, it is a prototype drug. The onset of action it is prompt, and the duration of action is short. Now, what is the mechanism of this drug? It action on the thick ascending loop of inlay. Okay, we will again see the this diagram, because in if you ask the mechanism, you can draw this diagram. Okay, now this drug furosemide, it act on the this side called as the side 3. Now what happened to the side 3? It inhibit the reabsorption, means sodium chloride potassium, this is the reabsorption to occur. Now this drug furosemide inhibit the reabsorption. After the reabsorption, what happened? This causes the excretion of sodium chloride, and the potassium is excreted in the urine. Okay, and why it is called more efficacy? Because it affect, it inhibit the thick ascending loop of Henle. Also this also act on the PCT and the DCT also, and hence it is called as the more efficacy diuretic, called as the furosemide. So simply understand that furosemide inhibit the this co-transport system, sodium chloride and potassium, and hence it causes the excretion of sodium chloride and the potassium. Okay, so this is called as the mechanism of that of the furosemide. So here also you can clearly see that loop diuretic, okay, block the sodium potassium and chloride co-transport, so it causes sodium potassium and chloride excretion. So major site of action is thick ascending loop of Henle, hence it is called as the loop diuretic. It inhibit the sodium potassium chloride co-transport system. Potassium excretion increase due to the high sodium load during the distal tubule. Okay, along with the sodium loss, potassium loss it also causes, and hence adverse effect of this drug, it is called as the hypokalemia, because potassium excretion it is occur. This furosemide also weak carbonic anhydrase inhibitory action, and increases the carbonate action. Okay, it increases this excretion as well. Furosemide also increases the calcium excretion, calcium excretion in the ascending loop of Henle. It also raises the blood uric acid level by competing with the proximal tubule secretion, as well as increasing reabsorption of the proximal tubules. Okay, and hence it causes the hyperuricemia. This action you must be understand that by this action you can clearly understand that what is the side effect of that of the this drug, because this side effect is generally asked. So side effect is hypokalemia, then it causes again the hypocalcemia, hypomagnesemia. It also raises the blood uric acid level, means hyperuricemia, means it precipitate the gout. So okay, so this is called as the mechanism of that of the furosemide. So you can draw the this diagram, and you can simply say that this inhibit the this transporter system by drawing this diagram, and you have to inhibit this site 2 in the mechanism of that of the furosemide. Pharmacokinetic, it is readily absorbed orally, bioavailability is 60%, lipid solubility is low, and it is a highly protein bound to the plasma protein, conjugated with the glucuronic acid, and excreted unchanged by glomerular filtration as well as tubular secretion. So again, you can clearly see that this loop diuretic inhibit the this portion. Okay, inhibit the sodium potassium chloride co-transport in the ascending loop of Henle. This is called as a descending loop. This is the ascending loop of Henle, and hence resulting in excretion of that of the sodium chloride and the water in the tubules. Most efficacy diuretic. Now next drug, it is a bimetanide. Is more lipid soluble. Viability is 80 to 100%. Preferred for severe congestive heart failure. It is drug used in congestive heart failure. Okay, next drug, it is a toracamide, another high serum diuretic with properties similar to the furosemide, but it is difference, it is more potent than that of the furosemide. Now, what are the uses of high serum diuretic? What is uses? First is the edema. Edema means when there is a volume, it is increases. Okay, volume is decreased by using the diuretic. Okay, irrespective of the etiology of edema means, if it is edema means swelling, it is occurred due to that of the cardiac, hepatic means liver or renal, or both three factor. You can use the edema of these three condition. Okay, high ceiling diuretic is prepared in congestive heart failure. Now second, it is the acute pulmonary edema. Pulmonary edema means which is occurring that of the lungs, called as the acute pulmonary edema. Left ventricular failure. Cerebral edema, when the edema in that of the brain. Hypertension, you have seen in that in the classification of the hypertension, these drug are used. High silical diuretic are specially indicated in the renal insufficiency. Okay, next use, along with the blood transfusion in the severe anemia to prevent the volume overload. It also is in the hypercalcemia of that of the malignancy. Okay, now you see the second category, it is the thiazide diuretic. It is a medium efficacy diuretic. Now you see again the and this diagram. Again, now this action, now thiazide diuretic, it inhibit the action. Okay, this thiazide diuretic, it inhibit the this site is called as the site 3, which inhibit the this co-transport system, sodium and chloride, and due to that it causes the excretion of sodium and chloride. Okay na? Hence it is called as the thiazide diuretic. Site of action, it is the distal convoluted tubules. Okay, it major action is occur in the distal convoluted tubules, called as the thiazide diuretic. Okay, so this is called as the thiazide diuretic, which act on the distal convoluted tubule and inhibit the reabsorption of sodium and chloride co-transport system. याच्यामध्ये तुमचं पोटॅशियम पण होतं, याच्यामध्ये काय तुमचं सोडियम अँड क्लोराइड. ओके, सो इट इज कॉल्ड एज द सोडियम क्लोराइड को ट्रान्सपोर्ट सिस्टम. So simply, again, what is mechanism? It is a medium efficacy diuretic with primary site of action in the cortical dilating segment or early distinct tubules, called as the site 3. They inhibit the sodium and chloride symport. Okay, symport means goes in the same direction in the luminal membrane. Some of the thiazide additional, it also has the carbonic anhydrase inhibitory action on the proximal tubules also. Okay, so it has also has the both these two drug has the carbonic anhydrase inhibitory action also. It also increases the bicarbonate and the phosphate excretion also. It also exchange with that of the increased amount of sodium. It also exchange with the potassium, and hence it also causes the sodium potassium excretion is increased with that of the sodium excretion. Okay, hence it again it causes the hypokalemia as a side effect. Same, it also causes the decrease in the calcium excretion and increase the magnesium excretion by direct tubular action. Okay, so greater reduction in the uric acid and the free water clearance. Negative free water clearance means there is a reabsorption of excess free water, it is takes place, called as the negative free water clearance. Okay, pharmacokinetic, it is a well absorbed orally. action is within the more lipid soluble agent. Okay, so you can read that pharmacokinetic. Next drug, it is the chlorthalidone, long acting compound, excessively used as a antihypertensive drug. Metazoline, it is useful in the severe renal failure. It is mainly used in the edema and occasionally for the hypertension. Okay, now next is the indapamide. It is diuretic action is same. It means antihypertensive action and used for the that purpose only. Now, what are the uses of these two category? Okay, this two category means uses of furosemide and the thiazide drug. What is the first use? It is the edema. Edema, it is occurred due of the excess fluid. Okay, so to reduce the excess fluid, you have to use the drug, diuretic drug. Now, second category is the hypertension. Thiazide, especially chlorthalidone, it is the first line drug for the antihypertensive therapy. Diabetes insipidus decreases the free water clearance and use in the nephrogenic diabetes insipidus. Diabetes insipidus, it is occurred due to that of the absence of that of the antidiuretic hormone. And nephrogenic means due to that of the failure of that of the working of that of the nephron, it causes the diabetes mellitus. Diabetes insipidus. So these drugs are useful in treatment of the diabetes insipidus. Hypercalcemia, it is recurrent calcium stone. Thiazide act by reducing the calcium excretion. It is used in the hypercalcemia. Now, complication adverse effect which is commonly asked in the examination. Okay, the first, it is the hypokalemia, because it causes the excretion of that of the potassium and hence it causes the hypokalemia. Okay, uh, degree of hypokalemia appear to be relation to the duration of action of the diuretic. This longer acting diuretic drug causes the more potassium loss, and due to that it may causes weakness, fatigue, muscle cramp, or cardiac arrhythmia as a serious complication. Okay, now what? How can we treat the hypokalemia? It is prevented by, you can use the dietary potassium intake. Okay, you can take the to reduce the hypokalemia. You take the potassium intake, or there is a supplement of the potassium chloride, or concurrent use of potassium sparing diuretic. Okay, potassium sparing diuretic, because this drug does not causes the potassium excretion. Hence, it is called as the potassium sparing diuretic. Okay. You can AC inhibitor, also in the AC inhibitor also causes the hypokalemia. Okay, hence these two drugs should not be given in the combination, because both drug causes the hypokalemia. Okay, in the AC inhibitor or AT antagonist, we can see that the adverse effect is the hypokalemia. Now next use is the acute saline depletion. Okay, uh, acute saline depletion, when there is a more water loss, then it causes the dehydration and the mark fall in the blood pressure. Dilutional hyponatremia, it called as the toxicity of the water. When the person takes too much of water without adequate of that of the electrolyte, called as the dilutional hyponatremia. GIT and CNS disturbances, nausea, vomiting, diarrhea, headache, giddiness. Giddiness means tendency to the fall. Weakness, paresthesia means numbness, impotence, are complication with the thiazide diuretic. Hearing loss, again high ceiling diuretic, furosemide, it causes the hearing loss, and hence it should not be given with the streptomycin drug. Okay. Next, allergic manifestation, rashes, photosensitivity, blood disgases, hyperuricemia. Again, this is very important adverse drug reaction. In the, I think in the uh, mm, previous year GPAT examination, this question is asked: which of the following drug causes hypomagnesia, hypercalcemia, hyperuricemia? Okay, so this drug causes the hypercalcemia, hyperglycemia as a side effect. Okay, but only it causes the calcium, it level, it is decreases this by this drug. Hyperuricemia, and hence it precipitated the gout. Okay, hyperglycemia, hyperlipidemia, hypocalcemia. ओके, सगळं हायपर होतं आणि बहुतेक त्याचा आन्सर काय होता आहे तुमचा लास्ट इयर जीपॅट क्वेश्चन. इट इज हायपोकॅल्सिमिया विच इज ऑकर विथ द हाय सेलिंग डायरेटिक ड्रग. Again it causes the magnesium depletion. Okay, again it causes the magnesium depletion, it is also occur. Renal efficiency, diuresis induced cirrhotic and should be avoided during the toxemia of the pregnancy. Okay, so this is called as the mechanism of action of the thiazide, which is act on the DCT, and loop diuretic act on the this ascending loop of Henle, and this is the cortical diluting duct. Okay, so this is called as the mechanism action of that of the furosemide and the thiazide drug. If you have any questions, you can ask in the chat box now.
In case of this prokaryotic cells, histone is absent in its chromosome. Or in case of
Or
eukaryotic cells,
you can unmute yourself and ask the questions.
around the histone. Okay. So first here we should understand what is histone. Okay. So histone is nothing but
Hello.
Type of protein which is found in chromosome, right? So in case of prokaryotic cells, there is
Or you want to any repeat, you can ask.
DNA bounded around the histone of eukaryotic cells. So histone is what? It is a typical protein which is found inside the
Other
chromosome.
degree student,
So this histone is.
you can ask in the chat box, so I can answer the questions.
Okay.
Only 10 minutes remaining, so ask.
Now, when this histone binds to the DNA, that will give the
You can unmute yourself.
shape.
Can also ask the
When
questions.
it binds to the DNA, and that will give the shape to the chromosome and help to control the activity of the genes. Okay, that is the histone. Now,
Hello.
Another point.
Diabetes insipidus means due to that of the absence of that of the antidiuretic hormone called as the diabetes insipidus.
Moving towards the next point, that is third point. In case of prokaryotic, there is a asexual reproduction, and in case
it is due to that of the nephrogenic means two types of. There is a, I think, nephrogenic means due to that of the kidney is damage झाला असेल तर diabetes insipidus. Antidiuretic hormone which is secreted by the posterior pituitary. Okay, so this called as the diabetes insipidus. Opposite, it gives the action opposite to that of the diuretic.
What happens in
Okay.
case of asexual reproduction?
Anti-diuretic.
Separation of the body into two new bodies. Okay, binary fission or asexual reproduction is what? The parent body gets separated into two new bodies.
Again, any questions?
So, in the process of binary fission,
Degree student.
An organism duplicates its genetic material. You can consider that an organism.
Okay, so this is the mechanism of that of the thiazide drug. Sorry, furosemide. You have to in the mechanism you have to draw this diagram. Okay, you just draw this diagram and you have to draw this side, and you have to just show that this furosemide drug inhibit this sodium chloride potassium co-transport system. Hence, it causes inhibit the reabsorption and causes excretion of sodium chloride and the potassium. And thiazide diuretic inhibit the sodium and chloride in the site 3, which is present in the distal convoluted tubules, and along with this also it causes the excretion of the potassium. Again, hyperuricemia, hyperglycemia, hypokalemia, hyponatremia, these are the adverse effect of that of the this drug. Okay, we'll see the only two category of drug in the today's lecture. This drug, and next lecture, in the next lecture we can discuss the other drugs or target of action of the other drugs. Okay, this thiazide diuretic inhibit the this, so it blocks the sodium chloride transporter and causes sodium chloride excretion of that of the drug.
मेन पॅरेंट पासून जे दोन नवीन ऑर्गॅनिझम तयार होतील, तर त्या दोन नवीन ऑर्गॅनिझम मध्ये हा डीएनए डिवाइड झालेला
student must ask the question. Okay, if you have any difficulty in understanding, you can ask the question or ask in the chat box.
In case of eukaryotics, it is a sexual reproduction, that is mitosis and meiosis will
anything you are not understand, you can ask.
Mitosis and meiosis, that is in case of a eukaryotic cell, mitosis is a process of nuclear division, right? It is a process of nuclear division. Nucleus जो असतो त्याचा division होणार आहे याच्यामध्ये. In eukaryotic cells that occurs when the parent cell divided to produce the two identical daughter cells,
हॅलो,
right?
क्वेश्चन नसेल तर तसं सांगा, नो क्वेश्चन्स म्हणून.
So time is running out now. The link will be deactivated in few minutes.
No questions, sir.
ठीक आहे, जोपर्यंत लिंक अवेलेबल आहे तोपर्यंत आपण कंटिन्यू करूया. लिंक डिॲक्टिवेट झाल्याच्या नंतर आपल्याला थांबावं लागेल तिथे. ठीक आहे. सो इम्पॉर्टंट पॉइंट इज दॅट इन केस ऑफ मायटोसिस काय होणार, इट इज अ प्रोसेस ऑफ न्यूक्लियर डिव्हिजन. न्यूक्लियर डिव्हिजन मध्ये काय होणार आहे की युकॅरियोटिक सेल व्हेन अ parent cell of that particular eukaryotic cell is divided to produce the two identical daughter cells. Okay, during the cell division,
Okay, we'll stop now.
mitosis refers specially to the separation of the duplicate genetic material. Okay, that is the separation of the duplicate genetic material that